Hello, hello, hello to everyone. Good afternoon, and thank you for joining us again. Today we are doing something about speech and language disorders among children, and we have a very experienced speech and language therapist to talk us through. Her name is Ilani. She works at Red Cross War Memorial Children's Hospital in Cape Town, South Africa, where I'm currently doing a fellowship, and she's one of the people who have really inspired me, who've been helping me. And I thought that I should just give my audience the benefit of her expertise. So this afternoon, we are talking about speech and language milestones among children. I'm just going to share to my Facebook wall. So if you join, please share to your Facebook wall and tag your friends. And like I always say, tag your friends' teacher, because the teachers have a very big role to play when the children are in school. The children are with them, and they should know what to look out for as well, and prompt us, the parents, who may not know what this is about. So I'm just going to share to my Facebook page, and then we will start just now. So I have already introduced Ilani. She's a speech and language therapist. Perhaps she can just start by telling us what a speech and language therapist does.
Hi, Sarah. Thank you for having me. It's a big privilege. So a speech language therapist has a broad scope, and we can help with a variety of difficulties. The first part is in the name, speech and language. So we help with a broad array of speech and language difficulties, be it a delay or a disorder. We also help with feeding and swallowing difficulties. We can help from neonates to the elderly population. And we also work in various settings. So be it primary schools, the school setting, hospital settings. So even if I must say so myself, we are quite versatile.
Okay, so we are also very privileged to have you. You said you work from newborn, a baby who is born today, until whatever age is the last age that human beings have. All right, so we are talking about speech and language therapy, speech and language milestones. And as usual, our audience, you can leave your questions in the comments, and then we will answer them for you. But first off, just tell us broadly, what are the things we should know as parents? Most of our audience are parents, so what should we know and look out for in our children?
So if we look at communication development, I think firstly it's important to just recognize that communication is just one of the domains of development within your child. Although it is a very, very important domain which influences emotional well-being, social well-being, academic success, and also later on vocational success. And before we can know what to look out for in communication, we just need to be aware of what communication actually is. So often as parents, we think a child speaking, saying words and sentences, that is the most important thing to look out for. That's the only way of measuring, is my child learning to communicate? But that is not true. So communication consists of various things. It consists of speech, so how you sound when you speak, how you pronounce sounds, how fluent is your speech, how does your voice sound, and also language. And so language is how you understand when others speak to you. Can you understand and perform instructions, for example? And then also how you put your thoughts and ideas and wants into words and sentences. So if we want to talk about milestones, it's important to mention that a milestone is just a guideline. It's not a precise target. It can often cause great anxiety under parents if someone tells you by 12 months your child should have said mama, and now your baby's 12 months and she hasn't said mama, and you keep thinking, what is wrong? So a milestone is just a guideline. It's what we expect children to do, certain actions and behaviors around a certain age. we normally say we give a 3-month grace period, more or less. So we
Okay.
look at the milestone, and if a child is within three months of that, but still not achieving that, we are not too worried. If after 3 months we see the child is still quite far away from that milestone or not reaching it, then I would say seek professional help. Um, Before I cover some of the milestones, I just also like to say with milestones, it's important to be able to distinguish between delayed and disordered behavior or milestones, especially in communication development. So delayed milestones would be that your child is doing the typical things, she or he is just a bit slower. So if you imagine yourself climbing a ladder, your child is climbing the ladder step by step, but he or she is just a few steps behind their peers. That is different from disordered milestones, where the child is doing things that is not typical and not part of the ladder you expect a child to climb. And that would, for example, be someone on the autism spectrum. That's just an example. Um, do you want me to go over some of the most common milestones?
Yes, but I found it interesting that you said you always give a grace period of 3 months. So if your child is not saying mama by a year, you still give the chance for the child to sort of catch up or be able to say, do the things that you expect the child to be able to do. I think it's reassuring to all of us that we don't have to go by a date. Today is the day my baby is this old, and so my baby is not doing this, and then we are anxious. That's very reassuring for us. And to our audience, once again, you can put your questions in the comments, and then we will answer them for you. So yes, could you please tell us what to expect from when?
Perfect. So, yes, just to talk about the grace period again, it is important to not say, it's just a late talker, he will catch up. But it is also important to not be over paranoid, because that anxious type of parenting and almost putting a lot of pressure on your child to say their first words, for example, can have negative influences on their communication development. So I'm going to cover 0 to 3 years, because that's the period where the most communication development occurs. And after that, the milestones become a bit more broad.
Okay.
So if we start with a newborn baby, in about the first month, at about around about the first month, we want your baby to start having a social smile. So what a social smile means is that the baby is smiling in a response to having interaction with mommy or daddy. Often when your baby is just born, they will give you a big smile and parents will think, oh, look, he's smiling. But that's most likely just a reflex. But around about the first month, if you talk to baby, you play with baby, you are physically close to baby and you see a smile, that means good. There's a social smile, and that's the first step of communication development. Round about the second month, you want your baby to start making sounds. At the beginning, they will probably just coo and make vowel-like sounds like ooh and ah, and all these sounds coming almost more from the back of the mouth. Um, and they will continue that throughout their first year of life, making many, many sounds and almost experimenting with what they can do. Um, then at about 5 months of age, your baby will start imitating your facial expressions. And this is a very important step in communication development. When you see that if you smile, baby smiles, or if you make big eyes, baby makes big eyes. Because children learn through imitation. So this tells us that your baby is definitely on the right track. At about 8 months, your baby will start refining their babbling skills. So they will start saying ba ba, da da, ta da. Um, this is also a really positive step because now they are experimenting with the sounds we need to say words at a later stage. Then at about 12 months, we normally expect a baby to say their first word. So very often it's mama or dada. It's normally the word they hear most often,
Okay.
that they will say at about 12 months. Between 12 months and 18 months, baby will then pick up a lot of new words. So they will start saying mama, tada, stop, give. So pick up a lot of single words. No sentences yet, just words on their own. Important to mention also is that children mustn't only learn to say words, they must also learn to understand. So at about 12 months of age, you want baby to start being able to follow very easy instructions like stop or give. You also want them to start recognizing their own body parts. So if you ask baby, for example, where's your eyes? You want baby to be able to maybe make eyes with mommy. Or where's your head? Maybe they will touch their head. So it's always important that when you look at your child's communication development, remember it's not only what they are saying, it's also what they are understanding. And understanding becomes before saying. So a child must
Okay.
understand first before they will be able to say words and sentences.
So I
So
have a
how?
question.
Mm.
Um, do does speaking different languages in the home delay a child's speech?
That is a good question, Sarah, and it's one that we get very often. So raising your child to be bilingual or trilingual does not have a negative influence on their communication development if you do it in the right way. So sometimes what you will see is if you have a child that from birth is exposed to, let's say, two languages, um, it might take them a little bit longer to say their first words, but once they acquire the languages, they acquire it to a level that is quite high and almost more sophisticated than monolingual babies.
Yes.
So there is no negative influence to exposing your child to more than one language. It is just very important to not mix languages while you're doing it. So we want to teach them that it is two separate systems. So if you speak English, you speak only English. If you speak, let's say, my first language, Afrikaans, you will speak only Afrikaans. Do not mix the languages when you speak. You speak the one and you speak the other so that baby learns it's two separate systems.
Interesting. But I think that you know, in where I come from, when children are going to kindergarten, they have this assessment for them before they go to kindergarten. And the assessment is done in English because that is the language that we write all over our schools. So the assessment is done in English. And going to kindergarten happens at age 4. So when do they catch up? The children who are bilingual or trilingual, when do they have the same language skills as the ones that are monolingual?
I think that you can't really answer with a definite time frame because it will be dependent on how much exposure they have of both languages at home. If you are exposed, let's say in your scenario, you said that at 4 now you're going to kindergarten, you're having an English assessment done. If you were exposed to English from birth, most likely you will perform at a similar level than your peers. However, if you've only started your exposure from 2 or 3, or only now when you reach kindergarten, you might be a bit behind your peers. Um, but a child's brain is magnificent, and each child is born, or let me rather say this, often parents think your child is born English or born Afrikaans. That is not true. A child is born as a clean slate, and they will acquire any language that they are exposed to. The earlier that exposure, the better. Um, we normally say before a child reaches puberty, that is the best time frame to expose a child to new languages, because the brain is the most susceptible to absorbing all that knowledge. After that, it becomes a bit harder, but it's still possible.
Great. All right. So we were talking about the milestones. We had already passed 1 year before my question came in.
Yeah. So I think we were at about 18 months. So between 18 months, a year and a half, and 2 years, your baby will now start putting two words together to make a very short sentence, or what we call a two-word phrase. So often it will be something like mama no or dada give. And this is the start of your child's sentence building. Okay, this shows us that now your child is able to start building sentences. At this stage, your child is also very susceptible to picking up new words. So you must be very careful about the words that you use in your household roundabout from 18 months, because they start being sensitive to words they haven't heard before, and those are the ones that then stick. Um, from 2 years onwards, let's say from 2 to 3, that's now when your child or your toddler now will start expanding their sentences. So you will see their sentences gradually get longer, longer. At about 3 years, we want them to be able to make a sentence with 3, 4, 5 words in it. At 3 years, we want them to be able to say what their name is. Are they a boy or a girl? They must know one or two colors. They must be able to say all their body parts. And at this stage, your child must also have good understanding of language. So if you ask your child questions, like we call them WH questions, what, where, why, when, they must be able to answer these type of questions. If you tell them, who is that? Where is that? They must understand those question words and answer appropriately. They must also start to understand location phrases. So if you tell them, put this in the fridge, they must understand. Put this on the bed. They must be able to follow those instructions. And then from 3 years onwards, we want them to expand their sentences. They must become able to tell you about their experiences, to tell stories, to come back from kindergarten, for example, and to tell you what has happened throughout the day. And as they then get older, they gradually refine both their understanding and their expression of language.
Excellent. So within this age, 0 to 3 years, what are the things you wish parents would know or look out for and bring to your attention?
Okay, so there's definitely a few things that I think we as speech therapists often wish parents knew. Um, the first one is that you seeking attention or seeking help for your child is never a negative thing, and you can never do that too early. We often get parents and they bring in their child and they say, I've been worried for 2 years and I've brought my child in now. And then I think to myself, don't wait. If you are unsure, rather seek the advice of a healthcare professional, because exactly this period that you outline, 0 to 3 years, this is the best time to intervene with communication development. So we must start early. So I want to say it again, if you are concerned, if you are worried about your child's development, speak to a healthcare professional. Good place to start is your doctor. and they can then refer you to the right people. The other things that we often wish they knew, and there is also some general tips or strategies that parents can take to stimulate their child's communication development, is that when a child acquires language, we shouldn't force them and we shouldn't test them. We often say, "What is this? What is that? Tell mommy, what is this?" And you just want your child to answer, say, "That's a cat, that's a dog, that is purple, that is blue." Or when they are little and starting to say words, we will say mama, say papa. Now, say bottle. And that places quite a lot of pressure on a child to speak. So when a child acquires language, we shouldn't test them and we shouldn't force them. We should rather model the behavior that we want. So if you want your child to start saying bottle, you're not going to pick up the bottle and say, "What is this?" Say bottle. "What is this?" Say bottle. Because baby's just going to look at you with big eyes and feel very pressurized to say that word. Instead, every time you take out the bottle, you will say, "Oh, bottle, look, mama has the bottle." Because that's how children learn best, is by observing, listening, and then eventually imitating what mommy says.
Interesting. This is something that I didn't know. But looking back, I mean, that is how we teach children in nursery or kindergarten. And even when we are teaching people to read, we write it and then we point at it and we expect them to say it. Anything we take, but this is very interesting that we shouldn't test them. We should rather model the behavior. Interesting. I think I didn't know that, and it's good I know now. Yeah.
Yeah.
Then
I
I
think we are all guilty of that. Even sometimes in therapy, when you've worked with a child for a long time, or it's the end of the day and you're not so awake and alert anymore, you start realizing, "Oh, I'm only testing this child now. I'm just asking, say this, okay? What is this? Okay, say that." And that places quite a lot of pressure on a child.
Interesting. Interesting. And I get a lot of people who tell me, or they come to me and they are worried about their child's speech. And then when they are telling me their problem, they would say something like, "Oh, but he's an only child. There's really no one at home to speak with." What do you think about this? Does being an only child at home, or you don't have a lot of children to play with, what is its effect on speech and language development?
Yeah, that's a really good question, and something we always ask when we treat patients for the first time is, how much exposure does your child have to his peers, so other children his age? Um, Children absolutely learn the best by observing. They learn well from their parents, but they learn the best from their peers. So while they are playing and listening to someone that is there around about their age, they pick up a lot of skills. So a child being an only child does not necessarily have to be a risk for a communication delay. There are strategies that a parent can try. So maybe you have family members with children similar to your child's age, and you can arrange some play dates, or just exposing your child to friends around about their age. Other idea is, and what you say is great, that children go to kindergarten at age 4 in Ghana. Kindergarten is a great way of learning to communicate, because they are surrounded with children their age, and they can observe what my friend to the left and right are doing, and then I try to do it as well.
So if you've just joined us, welcome. We are talking about speech and language milestones. And if you have any questions, just put it in the chat or the comments, and then we will answer them for you. And do cartoons help?
In this day and age, I must say, social media, cartoons, cell phones, they are definitely here to stay. They are not always the best for communication development, although they do have a place. So what often helps, or what often happens is parents places their children in front of the TV or with a cell phone to watch a cartoon as a way of keeping them busy. Um, and although in the cartoon they hear language, they are exposed to language, nothing replaces that with human interaction. Um, so cartoons can have a place. I know that often you just want to keep your child busy and you say, just let's quickly watch Coco Melon for 10 minutes. But it's important to then afterwards discuss with your child, what did they watch? What did they do? Oh, they were singing about fruits. Let's think about all the fruits we get, for example. Cartoons will not help your child to learn to talk if they just watch it and there's no discussion with them about that afterwards. Because then they are just watching a screen. Sometimes children also pick up different accents to their families from cartoons, for example, an American accent. So it is important to afterwards discuss with them what happened in the cartoon, so that you make sure they understand the content and so they also hear those words coming out of your mouth without the, for example, American accent.
So this is interesting as well, because I mean, I've been in groups where somebody is complaining that their child is not talking as they expected them to be talking for age. And then other parents are like, oh, get cartoon DVDs, put cartoons on, and those sort of things. So it's really interesting. And what Ilani is saying is that if you want cartoons to help your child, you don't just put the child in front of the cartoon. Let there be an exercise after the cartoon, because the cartoon should not replace human interaction. So after the cartoon, your child should tell you what they watched, because then you are stimulating them to talk. So autism has become a very topical issue. Every now and then I get somebody telling me that they think that their child is autistic or probably on the spectrum. And what is there anything? I mean, we don't want parents shouldn't necessarily become therapists overnight, but is there anything that should make a parent wonder whether their child is on the spectrum? And if you have such a question, just put it in the comments, as I keep saying, and we will address it for you.
Yeah. So some red flags that parents can watch out for autism. And just as you said, parents should not become therapists, but if you observe these things, it is advised to speak to a healthcare professional about it. If your child did not smile or babble as a baby, so in other words, they weren't a very social child, they didn't have a social smile, or perhaps they started babbling and then all of a sudden stopped babbling and just went quiet, that is a red flag. Another red flag is a child that does not acquire first words. And it's almost, that they prefer to point and use gestures to communicate. They do not speak verbally. If they want something, they will pull mommy towards what they want, or they will show mommy what they want. That is also a sign that you can watch out for. Children who have behavior that often, if something in the environment changes or the parent is unable to meet their demand, they have a meltdown, so they will become very upset. They might become a little bit aggressive. If you feel that that kind of a meltdown or a big tantrum the situation did not warrant that big a response,
But who
and it
knows with
happens
kids? They are always
continuously.
throwing tantrums. 2-year-olds, 1.5 to 3, they are always throwing tantrums.
That is very true, Sarah. But if it is a repetitive thing, and you see every time your child has a huge reaction to certain things, change, a lot of people, noisy situations, specific textures or clothing, for example, then it's also time to speak to a healthcare professional. Sometimes children on the spectrum, we call it stimming behavior. They might be children who hum continuously. So you will see if your child just hums throughout the day, or they might make sounds, that are not sounds that you taught them. So they will go, and they do these behaviors continuously. Then it's also time to speak to your healthcare provider. I think as a parent, you will be very intuitive towards your child, and you will realize when what your child is doing does not seem typical to you. And this is what I said in the beginning, being able to distinguish between typical, just delayed development, and disordered development. Um, so being able to recognize, yes, my child is perhaps not speaking yet, but what he is doing is typical. He's reaching his milestones just in a slower way, versus what my child is doing is not completely typical. It's not what most children do.
Okay. Okay, so what happened? I was just trying to show a comment on the screen, and then we both went away from the stream. Now there is a comment. Well, he's just commending us. He says that, oh gee, he's just commending us. He's thanking us for bringing this topic, but it's not a question. Humphrey, if you have a question, please put it in the comments and we will address it. And so I guess we can just go on. If there are more red flags that you think parents should know about, we can go on and talk about them while I sort out this technical thing that is happening here. Yeah.
Yeah. So
Okay.
I think with red flags, instead of memorizing and remembering a lot of red flags, rather just focus on knowing what your child should do at what age.
Okay.
Because if they are not doing that about 3-4 months after when they should, that is a red flag. So we spoke
Okay.
about the language milestones. I can maybe mention a bit about speech milestones. So a recap: speech is how you sound when you speak. It is how you pronounce sounds. It's how your voice sounds. It's how fluent you are. So with speech sounds, at about 3 years old, you want to understand about half of what your child is saying to you. So we don't expect a 3-year-old to have perfect pronunciation, not at all. But you want to understand about 50% of what they say. At about 4 years, you want to understand about more than 75% in what they are saying. And from older than 4, about 5, you want to understand what your child is saying.
So before your child gets to class 1, definitely by the time your child gets to class 1, that's for the Ghanaians, you should understand everything that your child is saying, because in class 1, your child is 6 years old. You should understand everything they are saying. They should be able to
Yes,
come back from school and tell you stories. Okay. So Vinny
yes.
says hello to us. Hello back. Do you have a question? Please put it in the comments, because we are missing questions. We are feeling lonely because we are not getting any questions. So if you have a question, please put it in the comments for us.
Yeah. So,
Yeah.
so the different speech sounds that we get, they develop at different ages. And at about 6 years, we want a child to be able to say all the speech sounds. Of course, sometimes if a child must say a very long word, like helicopter or dinosaur. It's okay if they mix up some of the syllables, that is normal. But at about 6 years, if a child makes a sentence, it should be intelligible. You should understand.
Okay, great. So the question we have now is that what if there are no red flags, but the child just hasn't caught up with speech milestones at his age? Could it be a delay in speech?
Yes. So if you feel that what you are seeing in this child is, I'm going to say the word, I don't like this word, but normal, so typical, but he is just not in line with his peers, then it might be just a speech delay. And I'm saying just a speech delay, however, it is very important to then seek professional help so that you can catch up with that delay. Like I said earlier, the better, the earlier the better. So you want your child to try and catch up that delay as soon as possible so that it doesn't influence his performance in the classroom, for example, and his academic success.
Okay. I think a lot of times we don't realize it because I've had patients say that, oh, his brother also didn't talk early. But if that child is going to school, probably even understands everything that is being said, but cannot speak, then the child will not get all the benefits of what education provides. So it's important that even if you think that, oh, his brother didn't speak early, but you know that it's not at the same level as his peers, you should seek some help for that. I sometimes too, we feel we are sort of afraid of bad news, you know, and we don't want anybody to tell us the child has a problem. So we don't want to come. But like Ilani has said, these things, when you start seeking help for them early, then the outcomes are better. Somebody has just asked a question that I had, says that do speaking too many languages in the child's environment? So it's about a child's speech. When you speak a lot of languages in their environment, does it sometimes delay the child's speech, or does it help them to pick up talking?
So bilingualism or learning more than one language at the same time is not a negative thing. It should be done in the right way. You can definitely expose your child to two languages since birth, but very important is to not mix those languages. So if you are speaking English, you are speaking English. You're not throwing in an Afrikaans or Portuguese or French word as well, because children need to learn that they are now learning or acquiring two different languages. And so it's very important that they realize that they are not learning one language which they can mix the English and the Portuguese words. They are just learning one, they are learning two different languages. Sometimes we do see that children who are raised in a bilingual home, they say their first words slightly later than a child who just grow up monolingually. But it does, in the long run, it does not have any negative influences. And being able to master two languages has its benefits academically, and it also develops your linguistic section in your brain. And going forward, you then find it easier to learn new languages. So bilingualism is not a negative thing if the parents do it right. So what we often recommend is, why don't you try a strategy like one parent, one language? So maybe mommy and I talk English to each other, daddy and I speak French to each other, so that the child is not confused about, is this word English or is it French? Another strategy is one context, one language. So maybe at school, I speak English. At home, when it's family time, meal time, TV time, I speak Afrikaans, but when I do homework with mommy, I speak English again. So each partner or each situation is then connected to a specific language that makes it easier for the child.
So the problem I have always had with that, more of a social problem, is that our schools examine all our children in English right from when they are entering school. So if I speak ever in my home to my child, that's my vernacular, and my child knows how to speak the mother tongue, that child will not get into certain schools because the child doesn't speak English. And then that's a problem because the assessment is only in English. And this is something that I have been thinking about, and I wish that organizations like Pediatric Society of Ghana could say something about it, because it's actually an advantage for the child to have two languages. But if I speak ever in my house to my child all the time, and that child is going to some schools, the child will never get in simply because the child does not know how to speak English. And then the child is going to lose the advantages of bilingualism. And I can't say that, oh, let me make this child an English speaking child, and then when the child is 5 years, I now begin to speak my vernacular, because that is, I mean, it's a switch. Why is there a switch? And then it's more difficult for the child to pick it up that way. Anyway, that is by the way. So another question, can most children's speech be delayed because their parents are not interacting with them much? And also, is there no other child around to play with or interact with? So I think if the parent is not interacting with them much, and then there is no other child for them to play with, can the child's speech be delayed?
Yes, definitely. I think a very important message that I would like to highlight today is how important interaction is for language learning. You know, children do not learn how to communicate in laboratories or at school even. They learn to communicate through natural, real life situations that they experience mostly at home, especially, you know, since birth and the period before they go to school. So if a parent does not interact with their child and they don't have exposure to their peers or others their age, their language will be delayed. The parent has a very, very important role in stimulating communication development in their child. And it sounds like a big responsibility and a difficult one, but it is not at all. I think parents have an intuitive ability to know how to communicate with their children. But a few strategies that I can advise is, we call it OWL, OWL. So observe, wait, and listen. Okay, if you're communicating with your young child and life gets busy, it's dinner time and you must feed 2 mouths and still you must take a shower when your husband just got home from work, it's very easy to just speak for your child and not give them a chance to say anything, and you just go, go, go. But we should always try to observe, wait, listen. So look at what your child is doing. Wait for them to try and initiate an interaction, whether it's a sound or a word or a sentence, and then listen to what they are saying, and then only you respond. So it's important to give your child that opportunity to learn how to communicate and not to communicate for them. Another strategy is just...
But in West Africa, we say that children must be seen, not heard.
The speech therapist won't be happy with that, Sarah.
So I tell you what I want to say, and I know you have heard it, and that ends it. And just be seen. I don't need to hear you.
I think the speech therapists in Ghana need to protest about that a little.
Interesting. We have another question. How soon should a parent seek help or advice when they are concerned about a child's speech delay?
Yeah, I think immediately. I've said this a lot, but parents are very intuitive. And as soon as you are worried about your child's development, speak to a healthcare professional. It can't do any harm. At most, they can tell you your child is developing beautifully. and then you have your reassurance. If that's not the case and there is a problem or a concern with the development, you've addressed it and you can seek intervention as soon as possible. So don't wait.
Great, great. So I just want to encourage our listeners again that if you have any question, put them in the comments, or if you know someone who you think this is relevant to, tag the person, and then the person can join and bring their questions, and we are willing to answer them, because we actually want to know what is relevant to you. We don't just want to sit here and talk because you are the reason why we are doing this. Could autism or dyslexia be a factor affecting a child being able to string words together, so making sentences?
Yes, definitely. So dyslexia won't influence a child's spoken language as much, so what they are saying verbally, but it will affect their ability to write and to read. But autism will definitely influence a child's ability to string together words to form a sentence. One of the big characteristics of autism is that a child has difficulty understanding and also expressing, so using language. And we know that often children with autism, they speak much later than their typical peers, or a lot of them go on to not use verbal ways of communicating, and to use pictures or gestures to communicate instead. So autism and communication difficulties go hand in hand.
Okay, so you've taught us owl, observe your child, wait for them to speak, and then you listen. For whatever reason, autism is very topical now. A lot of parents I know are all worried, is my child autistic, and so on and so forth. So let's say something about autism. In case your child has been given a diagnosis of autism. I know every child is different, but are there some general things that parents can do apart from OWL to help their children?
Yeah. So if your child was diagnosed with autism, your child will have access, or should access, a whole team of health professionals that will help them to communicate, or to develop. And so the speech therapist's role will be to help find a way where they can effectively express their thoughts and their needs, and to reduce their frustration. Um, a big part of it is also to counsel the parents on what they can expect, and to explain that even though their child might be different and communicating differently to others, they are still a child. They still want to play and have fun, and they still have messages to send. Um, if your child does have autism, um, as parents, we think that speaking is the only way of communicating. But you must be attuned to your child, and look at all the other things that they are doing to communicate with you. They might be very good at using gestures, pointing to things, showing you what they want. Their facial expressions can tell you a lot. Their behavior can tell you a lot. If they are, consistently experiencing a meltdown, then you know the situation is not for them. So looking at your child and looking at all the different ways that your child with autism is trying to communicate is a good idea, instead of just pushing for speech.
But what will the effect of that be? For instance, if my child will not tell me that he wants to eat, he just goes and takes what he wants. And I want to encourage my child to say, "Mommy, please, can I have some food?" So it's more or less like I am encouraging the child to gesture, but that is not how the real world is. What's your take?
Yeah, I think it's a tricky question, and we give ideal answers, and we know that the real world does not always accommodate them and understand these behaviors. Um, let's say, for example, your situation where you want to teach your child to not just take food if he's hungry, but to show you that he is hungry. Um, with your therapist, you will decide on your goals. And so teaching him to now all of a sudden say, Mommy, can I please have food, is perhaps a goal that will take many years. But a goal could be to have a picture of food. And every time that he is hungry, he will go fetch that picture and bring that to mommy. That is often a strategy we use with children who are on the spectrum, who we know they are visual learners. They do much better with visual communication than just listening. And so you can put, for example, pictures of, let's say, food somewhere in the kitchen. And when your child is hungry, they fetch that picture and bring it to the parent to let them know that they're hungry. If he does that well, now we gradually expand it. Now maybe we want him to say food with a picture or hungry with a picture. And as the child learns these skills, you slowly make it a bit more complicated, a bit more complicated. And then hopefully one day your child will walk to you and say, Mommy, I'm hungry.
Great. So we have a question. Would you agree that parents encourage their children to learn or improve upon their speech through play? As in Africa, sometimes parents stop their child from playing. But Ilani, before you answer this, I really think that when it comes to play, the worst culprits nowadays are the schools. At least with my experience sending my children to creche and kindergarten, because in my understanding, a creche or nursery is more or less a daycare. It's just somewhere that the child should blossom through play, you know, learn all these things that speaking as own. It's not a place where the child should learn. It's more about pre-learning skills. It's not a place where the child should write. But you send your child to creche, they come back home with homework, like actual homework. And it's so interesting. There are even children who are repeating creche, like they are not moving to kindergarten because they don't have some of these so-called skills. So I think that the schools are a very big culprit, and that is why I always say that tag your child's teacher, because sometimes it's because the information is not available. Because frankly, how many speech therapists do we have in Ghana? If you're not working in a teaching hospital, you probably have not encountered one. So sometimes it's because the information is not available. Anyway, but the question is, can children develop their speech through play? That question is to you.
Yeah, no, 100%. We encourage play and you know, in our therapy sessions, we play. That is how we learn skills. You cannot force a child to learn by making them sit at a table and to say, we're going to learn 5 new words: cat, dog, bird. That will not work. Children learn the best through playing, and they often have incidental learning, meaning that they stumble upon something in this play situation, they find it interesting, and then they learn a new word or they learn a new skill. For children to learn, they need to be interested in that specific activity, and that's why you cannot force a child to be interested in something. They are always interested in what they are playing with, so it is the best opportunity for them to learn speech. A scenario or a strategy rather that we often tell parents is to follow your child's lead. So you will be interested in what your child is interested in. And it is that case with play. So if your child is interested now in this car, you will use this car to develop their speech and language. So maybe you can say, let's talk about this car. Mommy sees the car has 4 wheels. What do you see? That's just an example, but play is fundamental to learning how to communicate. Without playing, I don't know, our therapy would be very boring and we wouldn't have any patience.
Very, very interesting perspectives, and this is forcing us to rethink our approach to many things that we do with our children. Like I said, in Ghana, we don't have a lot of speech and language therapists, especially if you are not working in a big hospital like I was working, then it becomes very difficult. So it's a good thing that we are hearing these things from you. And play. I am so passionate about play. It's got to extent. I went to my child's school and told them that if they give the child homework, it is going to come back. And they actually stopped. So sometimes parents, we have to advocate for their children. They stopped giving my 3-year-old homework. And it is not homework like dots to dots writing or anything. Actual homework, like actual school homework. So sometimes as parents, we need to advocate for these things, especially if your child is in creche and nursery. Your child is there to play. It's simply because you are going to work, or maybe there's no one else to play with your child and you are sending your child there. You are not sending your child there to be Oxford or Cambridge educated for you. And these things cause a lot of harm to the children. So we are very grateful. I see we have only 2 minutes left. It's been an interesting discussion so far. And we thank those of you who have joined. And if you are watching us on replay, you can still put your comments down in the comment section or questions. I'll answer them, or I'll tag Ilani to answer them for you. And we are very, very happy that you have joined us. You can still share this to your groups and to your pages as well, because we want this to get to people. And if it doesn't get to people, then we are not making an impact, and that doesn't make us very happy. So thank you, Ilani. Just before we close, give us some final things that you want to tell us parents about our children's speech and language development.
Thanks, Sarah. No, I think most importantly, like I said before, if you are worried about how your child is communicating, seek help. Communication is very, very, very important to all aspects of your child's life. It's important for their social well-being. It's important for their emotional well-being. Your child's going to need adequate speech and language skills to perform in school. He's going to need adequate speech and language skills to work and perform after school. And the best time is to intervene early. So don't wait. If you have any concerns, seek professional help. And then lastly, seeing as you people in Ghana tell your children to be seen but not heard, make your child heard.
All right. On that note, we will all make an effort to make our children heard. They must not only be seen, they must be heard as well, because this is very important to their development. Like we say, if your child has a speech and language difficulty, it may affect schoolwork. And who wants that for their child? And we are happy that you have joined us. We thank you so much for sending in your questions, and we'll see you again next month when we do something similar. Thank you so much, and thank you, Ilani, for joining us. Bye-bye.